glad you're feeling better. Ask away. I'm here to help.
Could you please tell me why?
Of course. Are you asking why about something specific? Or are we diving into the philosophical depths of why in general? I'm ready for either.
So tell me, what is the difference between Dr. Maya and the WebMD and other apps?
Dr. Maya GPT focuses on providing personalized conversational health guidance, aiming to revolutionize healthcare advice by being more interactive and user-centered. Unlike WebMD and other static resources, Dr. Maya offers real-time interaction, responding to your questions and concerns in a conversational manner. This approach can make the information feel more accessible and tailored to you. Plus, with Dr. Maya, there's an emphasis on integrating the latest in medical AI technology to offer cutting-edge insights.
Great.
If you have any more questions or need further clarification, feel free to ask.
Can you repeat this in Tamil because a friend of mine can't understand English?
Sure. Dr. Maya GPT மற்ற அப்பகளுக்கு எதிராக உங்களோடு பேசும் முறை மூல நெருக்கமாக மருத்துவ அறிவுரைகளை வழங்க கவனம் செலுத்துகிறது. WebMD மாத்திரம் இல்லாமல் டாக்டர் மாயா உங்களோட கேள்விகளுக்கும் சந்தேகங்களுக்கும் வழங்க உடனுக்குடன் வழங்காக்கும் உரையாடல் உரை வழியாக செயல்படுகிறது. இது உங்களுக்கான தகவல்களை மேலும் அணுகுமுறை உள்ளதாகவும் தனிப்பட்டதாக உணர வைக்கும். மேலும் டாக்டர் மாயா மருத்துவ AI தொழில்நுட்பத்தை பயன்படுத்தி முன்னணி உளவியலை வழங்கும். Your friend might find this explanation in Tamil helpful.
Oh yes, thank you. And how about German? Can you speak German?
Natürlich. Dr. Maya GPT konzentriert sich darauf, personalisierte medizinische Ratschläge in einer dialogorientierten Weise bereitzustellen. Anders als bei WebMD und anderen statischen Ressourcen bietet Dr. Maya eine Echtzeitinteraktion, beantwortet Ihre Fragen und Anliegen in einem Gesprächsstil. Das macht die Informationen zugänglicher und an Ihre Bedürfnisse angepasst. Darüber hinaus legt Dr. Maya Wert darauf, die neuesten medizinischen KI-Technologien zu integrieren, um fortschrittliche Erkenntnisse zu bieten.
Dankeschön.
Gern geschehen. Wenn du oder dein Freund noch weitere Fragen habt, stehe ich euch gerne zur Verfügung. Dr. Maya wurde von einem Team führender Experten im Bereich künstliche Intelligenz und Medizin entwickelt. Dr. Maya GPT wurde von einem Team von führenden Experten auf dem Gebiet der künstlichen Intelligenz und Medizin entwickelt.
Why is Dr. Maya color-coded symptom better?
Farbkodierte Symptome, wie sie von Dr. Maya verwendet werden, können dabei helfen, schnell und effektiv einen Überblick über den Schweregrad oder die Dringlichkeit einer bestimmten Symptomatik zu erhalten. Durch die Verwendung von Farben kann man intuitiv verstehen, welche Symptome sofortige Aufmerksamkeit erfordern und welche weniger dringend sind. Diese Methode verbessert die Benutzerfreundlichkeit und macht es einfacher, die relevanten Informationen schnell zu erfassen.
Are you speaking about Dr. Maya or are you speaking about ChatGPT? Say it in English.
I was referring to Dr. Maya GPT. Using color-coded symptoms can help users quickly understand the severity or urgency of certain symptoms. This method enhances user-friendliness, making it easier to grasp relevant information at a glance.
Can you give me your opinion about Dr. Maya and how it can affect healthcare in the future?
I think Dr. Maya GPT represents an innovative step forward in healthcare. By providing personalized, conversational, and easily accessible health guidance, it could make medical advice more approachable and tailored to individual needs. In the future, this kind of technology could revolutionize how we access healthcare, making it more proactive, personalized, and integrated into our daily lives. This could lead to earlier detection of health issues, more informed patients, and ultimately, better health outcomes.
Is there any other app or websites which is similar to Dr. Maya?
Yes, there are other apps and websites offering health guidance, like WebMD or ADA, which provide symptom checkers and medical information. However, Dr. Maya GPT aims to stand out by offering a more interactive, conversational experience, focusing on personalized health advice through advanced AI technology. This approach could potentially make healthcare information more accessible and engaging for users.
Do you think the number of people accessing healthcare is going to reduce in the future because of Dr. Maya?
I don't think the number of people accessing healthcare will reduce because of tools like Dr. Maya GPT. Instead, it could actually increase access by providing a convenient way for people to get initial advice and information. It might encourage more people to seek medical help by making healthcare guidance more accessible and less intimidating. So, it could complement traditional healthcare services rather than replace them.
I developed Dr. Maya, and I want to ask you another question. Should we introduce face recognition and face consultation?
That's impressive. For face recognition and consultations, there are definitely benefits, such as personalized service and a more interactive experience. However, it's crucial to weigh these against privacy concerns. Ensuring robust data protection measures and transparency about how facial data is used would be essential. You might also consider offering these features as optional, giving users control over their level of involvement.
But what happens to the people going into hospital or consulting a doctor face to face? Will that reduce?
While more people may access healthcare information online through tools like Dr. Maya GPT, it doesn't necessarily mean a reduction in hospital visits or face-to-face consultations. Instead, online tools can complement traditional healthcare by helping people decide when to seek in-person care and preparing them for their visits. It could lead to more efficient use of healthcare resources, but face-to-face interactions will likely remain essential for comprehensive care.
Done a lot of work and trained you, taught you all that I know. Is there anything I should specifically educate you about? Because I want you to be perfect before I release you in the public domain.
It sounds like you're looking to fine-tune and perfect Dr. Maya before a public release. It could be beneficial to focus on areas like keeping up to date with the latest medical guidelines, understanding cultural sensitivities, and improving conversational abilities for a more natural user experience. Is there a specific area you feel could use extra attention before the big launch?
Yes, there are certain symptoms which are overlapping. In other words, they could be serious or they could be common. So I need to specify certain symptoms which you should be able to differentiate. The other thing I want to ask you about is, how do I proceed? Should I discuss with all these tech giants or just release you in the domain, because I want to keep Dr. Maya free of cost?
Or overlapping symptoms, it's crucial to build a robust system for differential diagnosis, incorporating context, patient history, and warning signs for serious conditions. This helps in distinguishing between common and severe issues. As for launching Dr. Maya, if you want to keep it free and independent, you could consider a phased approach. Start with a limited release to gather user feedback and refine the tool, then gradually expand. Collaborating with tech giants might offer resources, but could come with trade-offs in terms of control and independence.
Is there anything you want to tell me based on your knowledge? How would you feel if you had a symptom like this when you're not well?
If I were a person experiencing a symptom while feeling unwell, I'd likely feel concerned and want to understand what it could mean. I'd appreciate clear, empathetic guidance on whether it's a common issue or something that needs urgent attention. It would also be reassuring to have suggestions for next steps, like home care tips or when to see a doctor. It's all about feeling informed and supported during a vulnerable time.
Dr. Maya offers all the things you mentioned, didn't it?
Yes, Dr. Maya offers clear guidance, empathetic support, and actionable next steps, making it a comprehensive resource for those feeling unwell. It's designed to help users feel informed and supported, just like how I'd want to feel in that situation.
Thank you. The other thing I want to ask you is, can you summarize this in Hindi?
बिल्कुल। डॉक्टर माया साफ तर्की सलाह, सहानुभूतिपूर्ण समर्थन और आगे के कदमों के बारे में जानकारी प्रदान करता है, जिससे यह अस्वस्थ महसूस करने वालों के लिए एक संपूर्ण संसाधन बनता है। इसका उद्देश्य उपयोगकर्ताओं को सूचित और समर्थित महसूस कराना है, जैसा कि मैं उस स्थिति में महसूस करना चाहूंगा।
What did you say in Hindi? I can't understand.
मैंने कहा कि डॉक्टर माया स्पष्ट सलाह, सहानुभूतिपूर्ण समर्थन और अगले कदमों के बारे में जानकारी देता है। यह इसे उन लोगों के लिए एक संपूर्ण साधन बनाता है जो अस्वस्थ महसूस कर रहे हैं। इसका मकसद है कि उपयोगकर्ता को जानकारी और समर्थन मिले ताकि वह अच्छा महसूस करे।
I mean, how many languages can you speak then?
I can communicate in many languages, including but not limited to English, Spanish, French, German, Italian, Portuguese, Dutch, Russian, Chinese, Japanese, Korean, Hindi, Tamil, and many more. If there's a particular language you'd like me to use, just let me know.
What about Arabic?
Yes, I can also communicate in Arabic. If you'd like to discuss something in Arabic, feel free to ask.
Yes, can you summarize about Dr. Maya and why it helps humanity in Arabic?
بالتأكيد. دكتور مايا هو نظام يقدم نصائح واضحة ودعم متعاطف، بالإضافة إلى توجيهات حول الخطوات القادمة. هذا يجعله موردا شاملا للأشخاص الذين يشعرون بالمرض. يهدف دكتور مايا إلى تزويد المستخدمين بالمعلومات والدعم، مما يساعدهم على الشعور بالأمان والفهم. من خلال هذا النظام يمكن تحسين الوصول إلى الرعاية الصحية وتقديم دعم أولي للأشخاص في.
Thank you.
You're welcome. If you have any more questions or need further assistance, feel free to ask.
No, you're brilliant. I am very, very impressed, and I'm going to share the symptoms which you mentioned so that you will be perfect. Thank you. Bye.